There are a few things that patients are not aware of about the actual surgery, and even about themselves, that are important to discuss before your procedure. Genetics. They will play a big factor in the results you can achieve. That's right, your own body genetics will help determine what type of fat you have, how much fat will survive, what kind of shape you can obtain, how you will recover. For example, did you know that your left side and your right side of your body are completely different? They're almost like sisters, not twins. No person is symmetrical. And just to have fun, let's take a look at how different my left side is from my right side. Now I warn you, don't get scared. I promise I'll get better looking. It's not that scary. So here we go. Now what I'm going to do is I'm going to take my left side and my right side, and this program is going to divide my face in half, so I'm going to create two people. One person is going to be my left side, the other person is going to be my right side. And that's how we're going to see how different these two different parts are. So let's take a look. Here I go. I'm going to start to divide the body, or the face, sorry, in half. Now I've created two different people. Take a look at them. These people are so different. Look at my left side, how this is very narrow. Look at my right side, it's much wider. Look at the height of my face. On the left side, it's longer. On the right side of my face, it's shorter. You start to see the differences and appreciate it in this type of program. Look at my brow. It's arched on one side, but it's flat on the other. It gets not so pretty as you keep on going and paying attention to all these differences. Here it's narrower, here it's wider. So it's almost like two completely different people, and this is really important for you to understand, because I will never be able to get you that symmetry. Let's use some other people as examples now. Now here's a young, beautiful patient that I had, and take a look at how different her right side is from her left side. One side is extraordinarily curved, the other one is much straighter. Let's see what happens when I split her body in half, and we take a look at the two left sides together and the two right sides together, and I want you to be impressed by how different she looks. These are cousins, they're not even sisters anymore. So it's very important that you realize that I will never ever get you symmetry. The bone's different, the muscle's different. Everything is different about the left side and the right side. Some people have more of a severe difference, like in this particular patient. Others, it's not as obvious. So the biggest key that I want you to remember on this is that I will not get you symmetry, but asymmetry is natural and it's beautiful. This is the way we were made. The second genetic fact is that there's different types of fat. And we're going to get into that, and let me give you a video to illustrate what I'm trying to say. Fat characteristics. Some fat is extremely slow. How slowly am I added? Ay caramba slow. But some fat extracts extremely fast. Now what type of fat you're going to have, I never know until we are really in surgery. Other fat is smooth like water, it just flows. While other fat could be very clumpy, it extracts almost like molasses, and I have to struggle to get that fat out. It's very thick and somewhat difficult to remove. What fat you will have, I just never know, it's genetics. Some fat is hard like concrete, and I just can't get it out. Some fat is soft like butter. Some fat destroys easier, while other fat is tough like Arnold Schwarzenegger. It's all genetics. Some people have brown eyes, some people have blue eyes, some people have blonde hair, some people have brown hair. It's all about the genetics, and this is going to influence your overall result, and it'll influence how much fat I'm going to have available. But with this said, we could always get some really nice results by changing our techniques depending on the type of fat that you have. Now, what happens when I'm faced with these difficult challenges? A fat that comes out very slow, a fat that's extremely hard like concrete. Let's go over some of these struggles that we're going to face and how we overcome them. Let's take a look at this video so that I can help illustrate this a little bit better. Now, as I stated, genetics will play a big role in what kind of fat you have. When your fat is hard, it wants to come out in lumps and clumps. When your fat is soft, you'd think it would come out very smooth, but take a look at this example. Look how it's leaving impressions. So even soft fat can leave impressions on your stomach, giving you what we call the Tara Reid abdomen. Sorry she became famous for this, but that's where we're at. So what happens when we have these particular scenarios? How do we make it easier or better? Well, if the hard fat is like a clump of sugar, I'm going to powder that sugar up as much as I can, and I do that by inserting a cannula and breaking up the fat cells into almost what we would call fine little granules. So I'm pulverizing this fat, making it easier to extract. Once I've really broken all that fat up, now it pours out and comes out really simple and smoother. This is what we call safe lipo. And I use this technique quite frequently in patients. I correct a lot of liposuction defects, and this is a technique that I use, so I use the same technique to try to minimize irregularities. When you do this, even in very difficult cases, you can get some nice results. Now, many people will ask me, what does it mean if I have hard fat or clumpy fat or it extracts slow or fast? Well, what that means is I may be limited in the amount of fat that I'm going to have, and you may have a higher propensity towards leaving irregularities, making our job more challenging. So we have to adjust our techniques. Now, these techniques adjustments will help us and minimize some of these irregularities. It doesn't get rid of them completely, but it certainly minimizes it because we're paying attention to these particular issues.